Hello everyone, welcome to Patho Excellence. In this revision video, we are going to discuss how to write pathology answers and last day general pathology revision, including all the general pathology chapters starting from cell injury to infectious diseases. In this video, we will focus on last day revision, and this approach is equally relevant for theory papers, practical examination and viva voce. Adhering to a uniform writing protocol improves clarity, time management and scoring potential and reduce avoidable loss of marks. So let us now proceed with structured revision and discuss how to translate knowledge into well presented high scoring answers. So let's see first what is the important checklist when you write down long answers. So here this is a golden rule. Before you start, read question carefully and identify command words. What is the exactly asked in your exam, like whether it is describe, whether it is enumerate or gross and microscopic features or morphology or differentiating features, whatever is asked, you read question carefully and write accordingly. And second thing, decide heading first. Now this is the mandatory order when you write in exam. First is, this sequence is important. First, definition, which is 1 to 2 lines and textbook language. Classification, etiology and or causes. Pathogenesis, morphology, which include gross as well as microscopic features. Special points or types or variants if according to the topic, and clinical significance as well as complication according to the topic. So let's see what is the definition. When you write, it should be precise in the textbook language, and here don't give any examples. So here whenever you write definition, here this is the example of cell injury definition, which shows that cells are subjected to stress or noxious stimuli. So these are some important words which should be in your theory exam. So some highlighting points must be there in your definition, so that examiner know that you know definition well and you know topic uh, thoroughly. So never skip definition, it guarantees the first mark. Second, classification, either in the form of table or use bullets, and always use headings as well as indentation. Now table, if you write, it score better than paragraphs, right? And if classification is asked, don't write it before pathogenesis. So first write definition, then classification, then what are the causes for that particular disease. So etiology, causes, starting from general to specific, and use subheading, right? So this is some example where you write at least 5 to 6 causes, which fetches full mark. Now fourth is pathogenesis. Try to use a flow chart which give you full marks, and start with initiating factor and end with final outcome. For the example here given, like hypoxia, which leads to ATP depletion, leads to sodium potassium pump failure, cellular swelling, reversible injury, irreversible injury, and lastly cell death. So flow charts are important and they are examiner's favorite, so always use flow chart. Morphology, very important. It is covering 40 to 50% marks of any particular long answer. So divide into gross features and microscopic features. Along with these features, add diagram if relevant, which should be simple and labeled. Labeling is important, right? And In the morphology, you can use table wherever possible, like here gross microscopic features you can write in table form, so that it will be easier to check for examiner for checking the paper. Now spatial features or types or variants if applicable, right here like types of necrosis, types of inflammation, patterns of tumor. So this extra 3 or 4 points show depth of knowledge and you can score high marks. Clinical significance, complications, etc. should be short and relevant. No treatment details are required and diagrams are must in the form of uh, microscopic diagram as well as flow chart, right? Now, what are the common mistakes? Like if you forget to write definition, if you write everything in paragraph, mixing gross and microscopic feature, treatment if you write even not asked, and poor heading. So avoid all these mistakes. Now exam tips for students: underline headings, leave line after each heading, use table wherever possible, and most important, do not over explain rare points, and neat presentation is equal to more marks. So don't repeat one point for more than one time. Repetition gives you less marks, as well as over explanation of rare points are also not important. Now this was about long answer and how to now write short answers in pathology theory exam. So as we have discussed, first always read the question, what is asked in the question, like morphological features of myocardial infarction, right? So here it is clearly written in short answer that you have to write down morphological features. So morphology means gross and microscopic features. So you have to write down only gross features as well as microscopic features. So at that time, do not write uh, any extra points which is not asked. So start with exact definition, one line textbook language and direct answer to the question. Write under heading, no paragraph is required. Always write in points and avoid story writing. This is the commonest mistake by most of the students. So avoid story writing. Use key exam words like gross and microscopic key features are important, and underline important terms like definition, heading, diagnostic words, and diagram is must, simple and labeled. Even if you can draw rough sketch with labeling, it will give extra marks. So this is about how to write long and short answers in your exam. Now, there are some important definitions, differentiation tables, and flow charts of general pathology here. So, I am not going in detail. I will just showing how to write definitions and how to make flow charts and how to write table in exam. So here this is the definition of reversible and cell injury in irreversible cell injury. So in the definition you write according to textbook language and always highlight the most important points, and this will help you to remember definitions, as well as you can easily write down these points and make sentence properly for the definitions. So in this PPT, I have given chapter wise definitions, some flow charts, as well as tables to remember easily for last day revision. So this is about like first chapter, cell injury, where this is glycogen accumulation, pathological pigments, and what is the etiology factors for this reversible and irreversible cell injury in the form of flow chart. These are some tables where you have to remember the morphology as well as definition. Now, what are the different intracellular accumulation, and what are what are the microscopic and gross features of this accumulation. This is very important. Pathological pigments, exogenous as well as endogenous pigment. So this is hemosiderosis, localized and generalized. So you should write this type of questions in the form of a flow chart or table, and you can get high score, right? So this is very important. Pathological calcification. Here, whenever you write, what is asked, you should write first, and if you know extra points, you can add whenever possible, right? But the exact point in the definition must be there, like dystrophic. So here it should be tissue damage and serum calcium normal. So these are the points which are important when you write down in your answer. So highlight these points so that you remember these definitions accordingly, and you can easily write down in exam. So these are the some important definitions chapter wise. So I am sharing this PPT in Telegram channel. So link will be given here in description box. So you go through this whole important definitions, tables and charts, so that you can easily write all these answers according to the questions, and it will be helpful in your writing theory paper. So these are the important topics for general pathology. Very important. If you go through and if you do last day revision with this topic, it will be helpful for you. And here these topics include neoplasia and some of the important topics from genetics as well as infectious disease. So I hope you will go through this revision video and you read accordingly the topic, and you will get good marks in the exam. So thank you very much, and if you like this channel, then like and share and subscribe for more such topics for exam. Next topic will be about practical revision. So stay tuned.